Yeah. So as I was saying, that amniotic fluid is going to contain the cells of both the mother as well as the fetus. So the amniotic fluid will act as the source of the fetal cells, because for karyotyping or for doing any kind of molecular evaluation of the DNA of the fetus, you need to have its cells, isn't it? So you will get those cells from the amniotic fluid, because the developing embryo, it sloughs off, it gives off, it sheds off the cells from the embryonic mass time and again. And those sloughed off cells you can find in the amniotic fluid. So this amniotic fluid will be your source. So you will have to withdraw that. How do you do its withdrawal is one of the biggest questions that you should have in your mind. And that is the process of amniocentesis, wherein you have to very carefully, without injuring the baby, without injuring any other sections of the uterus, you need to withdraw the amniotic fluid. So this was first performed in 1952 for diagnosis of hemolytic disease, what you also call as the Rh incompatibility or the blue baby syndrome, erythroblastosis fetalis. And by 1970s, this became a very standard technique for karyotyping, wherein amniotic fluid is aspirated during 15 to 22 weeks of pregnancy. Now, whenever you perform this technique, there are a lot of points that you have to be very careful about. First and foremost is, where is the placenta located? Where is the fetus located? Because you're going to be making use of syringe and needle to aspirate the amniotic fluid. So under no circumstances we can prick the placenta or the fetus, because both of these are extremely sensitive. So a small prick could also be responsible for a miscarriage. So you cannot take that risk. You're doing a diagnostic test, you cannot create complications there. A very thin needle is inserted through the abdominal wall, and around 20 ml of amniotic fluid is collected. Please remember that the volume of the sample that you collect is very, very critical. You can't collect too much of this fluid because it has an important role to play there. And you cannot collect very less of the fluid as well, because then you won't get enough number of fetal cells. The time required for aspiration is anywhere between 2 to 3 minutes. Please understand that amniotic fluid is the source of exfoliated fetal cells. Exfoliated means the cells which have been shed off by the developing embryo, and those cells are further isolated and cultured. After culturing is done, you will have to break open the cells, and the karyotyping procedure will be carried out, and the karyotype results will then be available in 10 to 14 days. Obviously, if you want to do some other tests wherein sequencing may be involved, or some PCR may be involved, or FISH has to be done, the time will differ on the basis of what test you want to perform. You can check for chromosomal abnormalities, cystic fibrosis, neural tube defect, sickle cell anemia, Tay-Sachs disease. All this can be, looked for when you are doing amniocentesis. So the neural tube defect, which is also called as the spina bifida, is a condition wherein the neural tube, the vertebral column tube, its opening is going to close during the embryonic development, and if it remains open, you call it as the open neural tube defect. So in some cases, this structural abnormality takes place wherein the end of the neural tube doesn't close. It's going to remain open. So even this kind of a structural defect, we can test using amniocentesis. I'm sure that many of you have a question that how is it possible to detect this, using amniocentesis? I mean, it's a structural defect. So how is it possible that we will be able to detect this using the technique of amniocentesis, because we are just collecting the cells over here. So is it a genetic condition? Not at all. Please understand that there is a protein called as AFP, which is called as alpha fetoprotein. Alpha fetoprotein, abbreviated as AFP. This AFP leaks out of the open neural tube and starts accumulating in highly abnormal concentrations in amniotic fluid. Okay, so in amniotic fluid, you should not find AFP beyond a specific threshold. If you do find AFP in amniotic fluid in a very high concentration, it is an indication that the baby is having open neural tube. Okay, and this AFP can start getting accumulated in the mother's blood also, and that can be seen during the maternal serum screening that you do. So AFP levels in the maternal serum is also tested for, which shouldn't be high. If it is high, it's an indication that the baby may be suffering from open neural tube defect. Another condition is hydrocephaly. So hydrocephaly could be wherein the baby's brain or the head region is abnormally shaped. Okay, so here also there are specific markers which can be tested for in amniotic fluid to see if the baby is suffering from such a condition or not. This is also referred to as anencephaly, and this is wherein the neural tube fails to close at the base of the skull, and that leads to defect in the brain development. In most cases, the baby is stillborn or lives only for a few days. While in spina bifida, you will see that the neural tube fails to close along the spine, which damages the spinal tissue and the spinal cord. There could be some temporary or serious issues, paralysis, lack of bowel and bladder control, hydrocephaly, and mental retardation could be noted in such situations. Though in spina bifida, it's not at all necessary that the baby would die immediately. But in anencephaly, it is sure that the case will be of a stillborn baby or the baby will survive only for a few days. Okay. So in such scenarios, especially in structural conditions like spina bifida or anencephaly, no family history is required. It is not at all dependent on mother's age. Folic acid supplements are a must. Okay, so that's the reason why you will see that whenever a female is pregnant, vitamin supplements are given first, and she's told to consume those vitamins regularly. If familial history is there of these structural abnormalities, then the risk is high, and hence genetic counseling and testing will be required in that family. So as I said, alpha fetoprotein or AFP is the protein that you use as marker in case of spina bifida. It is produced by the baby's liver in the second of pregnancy and normally is present in amniotic fluid, but in low concentrations. Okay. Now, after birth, the AFP normally crosses the placenta and reaches into the mother's bloodstream. Adults do not produce AFP in measurable quantities. So in mother's serum, normally you shouldn't find AFP. But in neural tube defect cases, huge quantities of AFP will be seen in amniotic fluid as well as in mother's blood. So that indicates that the baby is suffering from neural tube defects. That's NTD there. Okay. So the AFP leaks out from the spinal opening. Many a times, even after doing these tests and finding that, okay, AFP is really not present in the amniotic fluid or in the mother's serum, and you think that, okay, everything is fine, still the baby may be suffering from NTD. And it would have gone undetected because either the opening was too small or that opening was just covered with a flap of skin, but still the baby is suffering from spina bifida. So AFP testing is not 100% efficient a marker, but still it is carried out whenever there is this risk. Similarly, acetylcholine esterase, presence of this enzyme in amniotic fluid, is tested for neural tube or ventral wall defect, because this is an enzyme which is normally found in the neural system, and if its concentration is more in the amniotic fluid, it could be indicating that something is wrong with the neural tube. So chromosomal results are 90% accurate. AFP quantification is also 90% accurate. But if you combine the techniques together, the accuracy is always higher. Like if you combine ultrasound with amniocentesis and with some other molecular biology technique, the efficiency is always higher, increases to 95 to 99% of accuracy. Though these tests may not be able to detect all kinds of birth defects and genetic disorders, nothing can ensure you 100% safety always. There are some complications after amniocentesis that you need to remember. There could be cramps in the abdomen. So after amniocentesis is done, the female is not allowed to leave immediately from the premises. They are kept under observation for some time. Especially a 24 hours observation could be there, but at least 6 to 8 hours of observation is a must. Any kind of weightlifting or strenuous exercise for next 2 to 3 days should be avoided. If there is bleeding from the vagina, any leakage of amniotic fluid, fever, severe cramps, infection needs to be reported. If there is any of these symptoms, there could be a miscarriage. 1 in 100 case happens that after amniocentesis there is a miscarriage. That's the reason why before the procedure is performed itself, the risk needs to be informed to the couple. The consent form needs to be signed by them so that they are well aware about the risks associated with it and also the benefits associated with it. So before we go to CVS, I want you to watch this video on amniocentesis.
Amniocentesis is a procedure that lets doctors detect or rule out problems with your baby's health long before birth. In the uterus, your baby is surrounded by amniotic fluid that provides protection and nourishment. Floating in the fluid are cells from your baby, providing doctors with genetic material for testing. In amniocentesis, your doctor will take a sample of this fluid to test for specific genetic disorders and birth defects. Amniocentesis is usually done in the second trimester of pregnancy, at 15 to 18 weeks. It is generally offered to women with certain risk factors. Age 35 or older, which increases the risk of chromosomal disorders such as Down syndrome. A previous child or pregnancy with a birth defect. Blood test or ultrasound suggesting a birth defect, such as Down syndrome or neural tube defects, or a family history of genetic disorders, such as cystic fibrosis. Amniocentesis may also be done in the third trimester for these reasons: to determine if the baby's lungs are mature enough should early delivery become necessary, to diagnose a uterine infection, or to check for anemia in a baby with Rh incompatibility. To begin your procedure, your doctor will use ultrasound to create an image of the fetus and nearby structures on a computer screen. Looking at this image, the doctor can choose a safe place to insert the needle. Your doctor may give you an injection of local anesthesia to numb the surface of your abdomen, where the amniocentesis needle is to be inserted. Carefully watching the ultrasound monitor to avoid contact with the placenta or the baby. Your doctor will introduce the thin needle through your abdominal wall into your uterus and into the amniotic sac. He or she will then withdraw a small sample of amniotic fluid, remove the needle, and cover the site with a bandage. Your body will make additional fluid to replace what was removed. Your doctor will continue to monitor the ultrasound to check that the fetal heartbeat is normal and the baby tolerated the procedure well. You may feel mild cramping or pressure in your lower abdomen. For about 24 hours after your procedure, you will be advised to avoid physical stress, such as vigorous exercise, lifting, prolonged standing, and sexual activity. Free
So I hope in the video it was very clear to you as to how the amniotic fluid is withdrawn. And while the process is carried out, keeping the sonographic probe constantly in contact is very essential to keep a check on the position of the baby, because the baby moves. So it shouldn't happen that you end up pricking the baby. That could be disastrous. So a constant check needs to be kept on the position of the baby and the placenta while you are withdrawing the amniotic fluid. The next technique sounds even more invasive. It's called chorionic villus sampling, or CVS. So chorionic villus sampling is wherein you are taking some part of the tissue of the developing embryo, and it's not the fluid. Because in amniotic fluid, the thing is that the amniotic fluid will have both the fetal cells as well as the maternal cells. So you have an additional step of separation of cells, okay, wherein you will have to do density gradient centrifugation to separate the maternal cells and the fetal cells, because the fetal cells are comparatively less denser as compared to the maternal cells. That's how you segregate those cells and then go ahead with the culturing of the fetal cells and further analysis of the same. But the second thing in that is there is very less yield of the fetal cells that you get from the amniocentesis process. Chorionic villus sampling also will involve some maternal cells being collected, but because you are ensuring collection of the fetal tissue, you are sure that you have the fetal cells with you also in adequate amounts. Now, chorionic villus sampling can be done in two ways. You can either do it trans-abdominally, wherein you will use a syringe and needle piercing through the abdominal region, or you can also insert a catheter from the cervix, and trans-cervically you can withdraw the sample. So this can be done in 10 to 12 weeks of pregnancy, much earlier than amniocentesis. Amniocentesis is normally done in 15 to 22 weeks. Here you can do this right from 10 to 12 weeks of pregnancy, and most of the time the karyotyping results have been found to be more than 99% accurate. Because placenta and embryo comes from the same totipotent stem cells, you can withdraw the tissue sample from there. Normally, when it's in the morula stage, that's 12 to 15 undifferentiated cell stage, from that section also you can take the sample. So the chorionic ectoderm, that is the trophoblast, and some part of chorionic mesoderm can be collected as a part of chorionic villus sampling. So you do the sampling and then go for a long-term culturing to get more number of cells. Obviously, the rest of the cells that are there, they will multiply further and they'll become part of the mesoderm, ectoderm, and endoderm. Many people combine CVS with amniocentesis because they just don't want to go with CVS. They also go with amniocentesis as a double confirmation method. Some people remove blood from the umbilical cord because umbilical cord also contains the fetal blood cells. So that's called as percutaneous umbilical blood sampling, or PUBS, pubs. So it's it's like a supporting evidence to what you have found from CVS, because people just don't want to go ahead with the results of CVS. They want some kind of supporting document which comes from the other tests like amniocentesis or PUPS. So the samples of the trophoblast or the chorionic villus is removed either transabdominally or transcervically. Again, finding out the fetal and the placental position is important. The physician, the gynecologist needs to first see if the position seems to be okay, and if it's okay to do a CVS until and unless there are no complications, it's all good to go. But if there are any complications, any position related errors, CVS should be totally avoided. Secondly, the patient preference will help you decide whether you want to do it trans-abdominally or trans-cervically. Okay, so the patient's comfort also matters a lot. There could be a lot of maternal cells called as decidua, which is collected, and that needs to be separated from the fetal specimen, so that what you are seeing is just the fetal karyotype and not the maternal karyotype. The amount of sample that's withdrawn is around 10 to 20 milligrams, using either a needle or a catheter, which is filled with tissue culture medium. Normally, the turnaround time, which means the report time, it depends on how long the cells take to grow. Once you have abundant number of cells, then you do the karyotyping. So at least 15 to 20 days is bare minimum that's required for the reports to be generated. Also, trophoblast cells which are obtained from morula, they can be analyzed on the same day or after 1 to 2 days of culturing also. But for the villus, long-term culturing is a must, and till you get further differentiated cells, you will have to wait, and then you analyze those cells. So long-term culture results will take at least 2 weeks. As I said, 15 days is bare minimum. But short-term results can give an idea of what is the possibility, and long-term results could actually confirm whatever you have found in the short-term analysis. There are a lot of controversies with CVS, especially if you are trying to detect any kind of structural abnormalities, limb-based abnormalities, heart-pair related structural abnormalities. There are controversies that the results may not be really very accurate. But CVS, as it is more invasive, you're directly withdrawing the tissue sample of the baby. It's very dangerous. There's a high risk of miscarriage. Though it provides information at a very early stage of pregnancy as compared to amniocentesis, because in amniocentesis you have to wait for 15 to 22 weeks. But here in the 10th week itself, you can start the analysis. So you get to know at a very early stage of pregnancy that what you need to do ahead. So you get more time to take a proper decision. And the couple gets time to absorb the information that's coming to them. Many a time it's traumatic, so they need some time to process it and come to a decision as to what they want to do. And because you're getting to know this at a very early stage, if termination of pregnancy is essential, it's less difficult physically as well as emotionally at the initial stages of pregnancy. As I told you, that the more you keep, the more you await it, then it's going to be difficult, not just physically, but also emotionally for the couple to go through it. But if you're getting this information at a very early point of time, you can surely opt if termination of the pregnancy is essential. Just give me a minute. I will come back. Now, in some cases, the CVS may give completely ambiguous results. Okay, this happens because of the mosaic pattern that's seen normally, wherein, in some cases it has been found out that fetus में कुछ cells में normal karyotype होता है और कुछ cells में abnormal karyotype होता है, और embryonic मल्टीप्लिकेशन के वक्त फिर कौन से सेल्स डोमिनेंट स्टेज पे जाते हैं और कितने अबनॉर्मल कैरियोटाइप वाले सेल्स आगे रहते हैं, उस पर डिसाइड होता है कि कंडीशन प्रेवलेंट होगा या नहीं होगा। तो कई बार रिजल्ट्स बहुत ही एम्बिगियस होते हैं कि तुमको कैरियोटाइपिंग में अबनॉर्मलिटी दिखा लेकिन बच्चा इज कंप्लीटली फिट एंड फाइन व्हेन इट हैज टेकन बर्थ। तो ऐसे भी पॉसिबिलिटीज होते हैं। ये मोजाइक पैटर्न की वजह से होता है क्योंकि कुछ सेल्स नॉर्मल दिखाई देते हैं और कुछ सेल्स अबनॉर्मल दिखाई देते हैं। अगर यहाँ पर बहुत सारा मैटरनल सेल्स का कंटेमिनेशन है तो एनालिसिस बहुत डिफिकल्ट हो जाएगा। तो इसलिए प्रॉपर डिस्टिंग्विश कर पाना बहुत जरूरी है बिटवीन मैटरनल सेल्स एंड फीटल सेल्स। एंड अगर गलती से आपने मैटरनल सेल्स एनालाइज कर दिए एंड यू आर कमिंग टू अ कंक्लूजन दैट एवरीथिंग इज नॉर्मल, देन तो और भी गड़बड़ है। So you will have to see to it that you are specifically analyzing the fetal cells only. CVS cannot detect neural tube defect or abdominal wall defect. Amniocentesis can do that, but CVS cannot. Normally CVS के बाद ultrasound, serum screening, amniocentesis किया जा सकता है to get more information as a supplementary or confirmatory set of information. So that can be done. So let me show you a video of CVS also. There's a video of CVS as well.
Chorionic villus sampling, or CVS, is a procedure in which a sample of chorionic villi is removed from the placenta for testing. During pregnancy, the placenta provides oxygen and nutrients to the growing baby and removes waste products from the baby's blood. The chorionic villi are wispy cellular projections that make up most of the placenta and share the baby's genetic makeup. Your healthcare provider might recommend CVS for prenatal genetic diagnosis early during your pregnancy. Before the procedure, your healthcare provider will use fetal ultrasound to show your baby's position on a monitor. If the placenta is in a favorable position, your healthcare provider might take the sample through your cervix. Your healthcare provider will open your vagina with the speculum and insert a thin, hollow tube called a catheter through your cervix. When the catheter reaches the placenta, gentle suction will be used to remove a small tissue sample. This is known as transcervical chorionic villus sampling. If the placenta isn't clearly accessible through the cervix or you have a cervical infection, your healthcare provider might take the sample through your abdominal wall. Guided by ultrasound, your healthcare provider will insert a long, thin needle through your abdominal wall and into your uterus. The tissue sample from the placenta will be withdrawn into a syringe and the needle will be removed. This is known as a transabdominal chorionic villus sampling. Your healthcare provider might recommend pelvic rest for about 24 hours after the procedure. Otherwise, you can usually resume your normal activities.
So these are the two significant techniques that the curriculum advises for you to know as pre-diagnostic tools. But let me tell you that unfortunately these techniques have been used for inappropriate purposes as well, like knowing the gender of the baby. And then after the test is basically done only to know the gender of the baby, and if it's a female, they go ahead with abortion, which we call as female foeticide. You know that this has been prevalent in India for a very long period of time, and that's the reason why there was an act which was introduced called as the PNDT Act, which is the Prenatal Diagnostic Technique Act. According to this act, you are not allowed to perform these techniques to identify the gender of the baby. Any medical personnel and the family or the individual who tries to do so will have to face legal repercussions. Medical personnel will lose the license of practice and will also have to, spend their time in jail. That goes ahead with the family members as well who do so. And let me tell you that it's really unfortunate that even after PNDT Act has been implemented, several people have been doing this since ages, for finding out the gender of the baby, wherein for money, even few medical personals have been involved in this, wherein they perform these technique only to identify the gender of the baby. Several sting operations were performed to, find out. In I think 6 to 7 years ago, there was in Mumbai a sting operation performed by media people, and they found several clinics who were doing this just for the sake of money. This is another thing wherein people should really understand that such activities, unnecessary activities, will keep the people devoid of such techniques who really need it for diagnostic purposes, for finding out if their child has some kind of structural or genetic abnormalities. So we really need to understand that it's high time that we use these techniques for the purposes for which they are devised, and not for the purposes of identifying the gender. If you see in other countries, they always know the gender of the baby right from the beginning. Okay, because they don't practice female foeticide. It is something which is so common in our country, and we should be working towards it to reduce it. To a great extent it has reduced, but the mindset is still there, which needs to be worked upon. Okay, so I think we will stop at this point for today, and we will continue with the pre-implantation diagnosis part in our next session. I hope that today you have understood amniocentesis and CVS, and we will continue with a pre-implantation diagnosis, which is normally when you are going for IVF, in vitro fertilization. So we will continue with the discussion on the same in our next session. Do you have any questions till this point? If yes, please feel free to ask.